Our immune system is a complex and powerful network of cells and proteins. It acts as our body's defense force, protecting us from harmful invaders like bacteria, viruses, and parasites. This intricate system works tirelessly to keep us healthy. However, sometimes this defense system can malfunction, mistaking our own healthy cells and tissues for foreign invaders. Autoimmune diseases arise from this immune system malfunction. In these conditions, the immune system mistakenly attacks the body's own tissues. This friendly fire causes inflammation and damage to various organs and systems. The result is a wide range of autoimmune diseases, each with its own unique characteristics. Imagine the immune system as a vigilant army. It is trained to recognize and attack enemies, protecting the body from harm. In autoimmune diseases, this army turns against its own people, attacking healthy cells and tissues as if they were enemies. This self-attack is the hallmark of autoimmune diseases. It leads to a variety of symptoms and can affect any part of the body, making these conditions challenging to diagnose and treat. Autoimmune diseases are not a single entity, but rather a vast and diverse group of over 80 different conditions. These diseases can affect virtually any organ or system in the body, from the skin to the nervous system. Some autoimmune diseases are relatively common, while others are quite rare. One example is type 1 diabetes, where the immune system attacks the insulin-producing cells in the pancreas. This attack leads to the inability to regulate blood sugar levels properly. Another example is rheumatoid arthritis, where the immune system targets the lining of the joints, causing pain, stiffness, and inflammation. Other autoimmune diseases include inflammatory bowel disease, or IBD, which includes conditions like Crohn's disease and ulcerative colitis, causing chronic inflammation in the digestive tract. Multiple sclerosis, or MS, where the immune system attacks the protective covering of nerve fibers, leading to problems with muscle control, vision, and other neurological functions. Lupus, a systemic autoimmune disease that can affect various organs, including the skin, joints, kidneys, and heart. These examples represent just a fraction of the many autoimmune diseases that exist. Each disease has its own unique set of symptoms and challenges, but all share the common thread of a misdirected immune system. The symptoms of autoimmune diseases are as diverse as the diseases themselves. They can range from mild and general to severe and debilitating. Recognizing the warning signs early is crucial for prompt diagnosis and treatment. Common symptoms of autoimmune diseases include fatigue. Feeling constantly tired and lacking energy is a hallmark of many autoimmune conditions. Joint pain and swelling, which is a common symptom of rheumatoid arthritis and other autoimmune diseases that affect the joints. Skin rashes, as many autoimmune diseases manifest as skin problems, such as rashes, redness, and itching. Gastrointestinal issues like diarrhea, constipation, abdominal pain, and other digestive problems can be signs of autoimmune diseases affecting the gut. Other symptoms may include muscle weakness, swollen glands, hair loss, mouth sores, and sensitivity to light. It's important to remember that these symptoms can also indicate other health conditions. Therefore, it's essential to consult a doctor for a proper diagnosis. The exact causes of autoimmune diseases remain largely a mystery, but research suggests that a combination of genetic and environmental factors plays a role. Scientists believe that some people may have genes that make them more susceptible to developing autoimmune diseases. Environmental triggers, such as infections, stress, and exposure to certain toxins, are thought to trigger the immune system to malfunction in genetically predisposed individuals. For example, some studies suggest that viral infections may trigger the onset of autoimmune diseases in some people. Risk factors for autoimmune diseases include family history. Having a close relative with an autoimmune disease increases your risk. Gender. Women are more likely than men to develop autoimmune diseases. Race. Certain autoimmune diseases, such as lupus, are more common in people of African, Hispanic, or Asian descent. Smoking, which is a risk factor for several autoimmune diseases, including rheumatoid arthritis. While it's impossible to prevent autoimmune diseases entirely, understanding the risk factors can help individuals take steps to minimize their risk or seek early diagnosis and treatment. Diagnosing autoimmune diseases can be challenging, as their symptoms often mimic other conditions. There is no single test to diagnose autoimmune diseases. Doctors rely on a combination of medical history, physical examination, and laboratory tests to make a diagnosis. Blood tests are often used to look for specific antibodies associated with certain autoimmune diseases. These antibodies are proteins that the immune system produces against the body's own tissues. Other tests that may be used to diagnose autoimmune diseases include imaging scans, such as X-rays, MRI, and CT scans, which can help visualize inflammation and damage to organs and tissues. In some cases, a small sample of tissue may be taken from an affected organ to examine under a microscope for signs of autoimmune disease. The diagnostic process may involve referrals to specialists such as rheumatologists, endocrinologists, or gastroenterologists, depending on the suspected disease. Currently, there is no cure for autoimmune diseases. Treatment focuses on managing symptoms, controlling the overactive immune response, and preventing further damage to organs and tissues. Treatment options vary depending on the specific autoimmune disease and the severity of symptoms. Common treatments include asterisk medications, anti-inflammatory drugs. These drugs help reduce pain, swelling, and inflammation. Immunosuppressants. These medications suppress the overactive immune response. Disease-modifying anti-rheumatic drugs, DMARDs. These medications are used to slow the progression of certain autoimmune diseases, such as rheumatoid arthritis. Lifestyle modifications, diet and exercise. Eating a healthy diet and getting regular exercise can help manage symptoms and improve overall health. Stress management. Stress can trigger autoimmune flare-ups, so finding healthy ways to manage stress is essential. Asterisk alternative therapies, acupuncture. This traditional Chinese medicine technique may help relieve pain and improve quality of life. Yoga and meditation. These practices can reduce stress and promote relaxation. Treatment plans are individualized based on the specific needs of each patient. Regular monitoring is essential to assess treatment effectiveness and make adjustments as needed. Living with an autoimmune disease can be challenging, both physically and emotionally. The unpredictable nature of these conditions, with periods of remission and flare-ups, can make daily life unpredictable. Common challenges faced by people with autoimmune diseases include chronic pain and fatigue. These symptoms can limit daily activities and affect quality of life. Emotional distress. Dealing with a chronic illness can lead to feelings of frustration, anxiety, and depression. Social isolation. The limitations imposed by the disease can make it difficult to maintain social connections. Financial burden. The cost of medications, doctor's visits, and other healthcare needs can be substantial. Coping strategies for living with an autoimmune disease include education. Learning as much as possible about the disease and its management is crucial. Support groups. Connecting with others who understand the challenges can provide emotional support and practical advice. Self-care. Engaging in activities that promote physical and emotional well-being, such as exercise, relaxation techniques, and hobbies, is essential. It is crucial to seek medical attention if you experience any persistent or concerning symptoms that could indicate an autoimmune disease. Early diagnosis and treatment are essential for preventing complications and improving long-term outcomes. See a doctor promptly if you experience persistent fever asterisk, severe fatigue, joint pain and swelling that lasts for more than a few days, skin rashes that don't improve with over-the-counter treatments, gastrointestinal problems that are severe or persistent. Don't hesitate to seek medical help if you suspect something is wrong. Living with an autoimmune disease can be challenging, but it is not insurmountable. With proper medical care, support from loved ones, and a proactive approach to self-care, individuals with autoimmune diseases can live full and meaningful lives. Remember these key takeaways. You are not alone. Millions of people worldwide live with autoimmune diseases. Knowledge is power. Educate yourself about your condition and its management. Seek support. Don't hesitate to reach out to family, friends, support groups, and healthcare professionals for help. Prioritize self-care. Make time for activities that nourish your physical and emotional well-being. By embracing a positive outlook, seeking support, and prioritizing self-care, you can navigate the challenges of autoimmune disease and live a fulfilling life. Thanks for diving deep into autoimmune diseases with us. Drop your thoughts or questions in the comments, like if you learned something new, and subscribe for more health insights to your wellness journey.